And then stage 3, which we'll obviously get to in the future, will be more about patient ownership. So the proposed measures are really more around the patient doing things and the patient initiating things. But we're not going to spend any time on that today. Again, our focus is really on stage 2. All right, specifically Measure 7. Measure 7 is really titled Patient Electronic Access. I've laid out the objective here for you. You are to provide patients the ability to view, download, or transmit their health information within 4 business days of being seen by their provider. There is a typo here. I want to make sure it's view, download, or transmit, okay? So those are unique actions that are taken by the patient. The patient does not have to do a view and a transmit. A view will suffice for that action. In terms of measuring how you certify for this measure or how you quantify, the first measure is more than 50% of all unique patients seen by the provider during a reporting period are provided that online access to their information. So that 50% actually is, that comes from all the patients seen. So that denominator is likely all the patients seen in the practice, whether they have a portal account or not. The numerator, so the 50%, are those patients that you provide timely access to. The second measure is more than 5% of all unique patients must view, download, or transmit their health information to a third party. So this is more about if you send them a CCD, them having the capability to view that CCD, download that CCD into something that they can save on their computer, which we'll touch on, or transmit that via something called direct protocols to another healthcare party. And that might be a hospital, that might be another provider, and they'll do that using what's known as a direct email address that would be provided to them by the other physician. So let's circle back around to this one more time. I want to make sure that's clear for everyone. There are 2 measures within this objective. More than 50% of all unique patients are given timely access, and then more than 5% are able to view, download, or transmit. All right, and we're really going to help you out with that view, download, or transmit. I want to jump into what this looks like for the patient. All right, so what does it look like when you send them a CCD? And this might be a chart summary. For some of your EHRs, this might be a visit summary, so a progress note. That's something that you probably want to work with your EHR vendor on. But anything that is sent to us in a CCD format, we will present to the patient. A couple of things I want to point out. When the patient actually opens up their CCD, so when they get to the point that they're looking at the information that you're seeing on your screen now, that is counted as a view. All right? So if the patient does nothing more than just view it, they are counted in your 5%. If they actually go the next step and they download, you'll see that down at the bottom. They can download a PDF or the raw data, an XML on its own. So the XML is literally the code of the CCD, whereas the PDF looks very similar and actually just like what you're seeing here on your screen. Now, if they take that step and they download, that also counts in that 5% for this patient. So 5%, that second measure of the 7th piece of that, that helps you meet that 5% of unique patients. Now, in the bottom right-hand corner, you'll see the option to send my information. This is the transmit capability. And if the patient clicks on that link, they actually will be presented with a screen where they can literally type in, or maybe they can copy and paste in the direct address that's been provided to them by another provider, another healthcare entity, whoever they want to share this CCD with. And it literally works very similar to email. So they put in the direct address that also is formatted very similar to an email. And when they click send, they receive a confirmation message that lets them know their information has been sent to that provider. Along with that transmission, we send both options here that are downloaded as well. So we send a PDF as well as the raw data. And that just allows the receiving provider to actually be able to import that CCD into their EHR, so into that patient's record.
I'm just going to interject here and say if anybody has questions, feel free to type them in and send them to us. We also have Stephanie Monk sitting here, and she can handle questions about integration-specific MU2 questions that you might have. Sorry to interrupt, Brady.
Not a problem. And I'd like to add to that, we welcome any integration-specific questions. We will do our best. And so if you're curious about your specific EHR product and how it may work with the Medfusion patient portal, we welcome those questions and we'll do our best to answer them. We may have to engage with your EHR vendor to get those fully answered for you, but we will do our best and we do welcome them. All right, so to close the loop here, specifically with the CCD view in the patient portal, when the patient pulls this up and they're actually seeing the same screen you're seeing here within their portal account, that does count as a view. They can then move on to download that information if they want to, as well as transmit that. Now, the second piece of this is how does the patient see what has happened in their account previously or historically? We have an area in the portal that's brand new, and it's actually called the account activity area. There's three pieces of this, that we're required to send or provide to patients. So what was actually done with the CCD? Was it viewed, was it downloaded, or was it transmitted? So we will show those three access types or actions that a patient or their authorized rep may have performed. Who did it? So we have this user column here. Was it the patient who did the view, the download, or transmit, or was it their authorized representative who actually did that view, download, or transmit? And when did that take place? So you'll see we give them a date and a time for when that action actually took place. And this log here is within the patient portal, and we are required to give the patient access to this information as part of this measure and helping you meet this measure. Okay, so that's patient online access. Fairly straightforward. Again, you send a CCD, and we handle the product functionality to allow the patient to view, download, or transmit that information to a third party. Now, measure 17 is secure messaging. This is what allows and monitors the patient actually taking initiative within the portal and sending a patient-initiated message to their practice. Now, what potentially counts in this? Appointment requests potentially count. Prescription renewals potentially count. Ask a staff questions, as well as secure message replies. So if you have sent the patient a secure message and you've allowed them to respond to that message, and they did so, that can count for this measure and helping you meet the 5% of unique patients who need to do that. Now, I do have a disclaimer here. You do want to check with your EHR vendor in terms of what they are counting for this measure, because again, guys, your certified reporting comes from your EHR. So you want to make sure that you're on the same page with them about what's counting within your certified reporting. Now, I touched a bit on what counts, and I do also want to hammer home these are patient-initiated messages, so things that the patient does on the portal. What does not count for this are messages that you send to the patient outside of a CCD. All right, so again, examples of this might be an appointment request, might be the ask a question solution, might be the prescription renewal solution. So this is an example of what it looks like within our portal today. You may have multiple labels for the ask a question solution. So you may have various subjects that a patient might be able to submit their question under. All of those will count for that secure messaging measure 17. Now, before I move on, you may wonder, well, what about some of the other measures? If we are part of a complete certification with your EHR vendor, your EHR vendor may be using the portal to meet other measures, such as clinical visit summaries, such as patient education, things like that. That would be something that would be included within their documentation. Today, our focus is really on what we assist in terms of our modular certification and that patient experience. All right. Now, I want to touch on some of our new utilization reporting that we have within the site generator. And you may ask, what is the site generator? That is actually an administrative area of the portal. If you need assistance accessing that information, our customer care team can help you with that. If you're currently in the implementation process as well, your implementation representative or project manager can help you access the site generator as well. And this is actually new functionality that we came out with within the past month. Now, utilization reports is going to help you keep track of the patient activity on your portal. Again, this is not certified reporting. You want to get that from your EMR vendor. However, this is going to help you keep track, notice across the top, on a quarterly basis, a monthly basis, a weekly basis, or even a daily basis. Now, the screen you're seeing here incorporates ask a staff questions, forms that are submitted, prescription renewals, appointments, etc. We also cross the span to using our bill pay solution. You'll see that in the utilization reporting as well. I just wanted to give you a glimpse of some of the key pieces that are more clinically inclined. And again, this is something that you can access in Site Generator to help you kind of realize what utilization and what activity you're getting in the portal. This can also help you do maybe targeted marketing campaigns. If there are specific solutions that are not getting heavy utilization, those might be solutions that you will really want to focus on in promoting to your patients so that they start to engage at that level. Now, some of the additional resources that I have used along the way and that I really think would be helpful for you, the ONC certified product list. And don't feel like you have to jot these down. We will send this to you following the webinar today so that you have them handy. But the first, the ONC certified product list. This is where you can actually search through all of the EMR products, other portal products, and even other third-party products that maybe have certified for other measures. You can actually search for their listings here. You'll find the Medfusion Patient Portal Modular certification here. You will also find certifications that we have with other EMRs. So any complete certifications that we have been included in, you would find those there as well by searching by your EMR vendor's name. The second one is the CMS Getting Started Guide. This is really helpful. If you're starting MU Stage 1 this year, or even if you're starting Stage 2, this is a good outline to help you understand what you need to do to get started. It also outlines the in-depth measures for Stage 1 and Stage 2. There are some new proposed measures for Meaningful Use Stage 1 if you're starting this year that are also outlined on the site. And I definitely recommend that you visit this website for assistance with that. Another really cool tool that I've used in speaking with some practices as well as internal here in training on MU Stage 2 or Meaningful Use in general is the CMS Timeline tool. All right, so this is a direct link to that tool. You can literally go there. You can put in the year that you're starting Meaningful Use, be it Stage 1 or Stage 2, and it will literally outline for you your attestation period. So how long? Is it 90 days or do you have to do it for a full year? It's a really, really good tool to make it clear for you how long you have to attest to be able to meet the specific MU2 guidelines. And last but not least, a quick link guide to the MU2 measures themselves. So these are the current measures for Meaningful Use Stage 2 in 2014. It breaks them down per each measure. So you'll see Measure 7, the Patient Online Access, as well as Secure Messaging included in this overview. But these are also, your overall EHR, everything you have to do to attest, inclusive of the patient portal pieces. All right, so that's everything for today. If there are any questions, we've got a lot.
Questions, yes.
So we encourage you to keep submitting those within the question area, and we will try to kind of walk through some of those now. And then if we don't get to your question, we will follow up with you with your specific answer to the best of our capabilities.
So I'll play moderator here and ask a few questions.
Great.
Does CMS define health information as a CCD, or is that Medfusion's interpretation? Is If a patient views laboratory results on the portal, is that not viewing health information?
That's a great question. So CMS does define the health information as a CCD. So the health information really comes into play for the view, download, or transmit, okay? And that's why there's the connection to the CCD. CMS and ONC have dictated that the standardized format of a CCD be utilized and implemented across all of the medical products that are certified by their certification bodies. So literally the functionality of being able to download and transmit is associated with the CCD format, and that has been dictated. And if you refer to the link that we will send out to you, it will spell out the information that is included within quote-unquote health information. So I definitely recommend that you take a look at that. Again, the connection with the CCD, though, is the capability to view, download, and transmit. So that's why they're married there, and that has been passed down by ONC and CMS. Great question.
Do we need to upgrade our portal functionality?
That's another good question. So the portal actually, because we are a SaaS-based product, the portal is upgraded. We do our releases every 6 weeks. So your functionality in terms of what you've seen today, the CCD viewer, the capability for a patient to view, download, and transmit, that is all built into the product today. Now, if you have to upgrade your EHR product to be able to send a CCD to the portal, that might be an upgrade that you do have to complete. But the capabilities are all built into the latest releases of our product, the Medfusion Patient Portal.
So Stephanie, that's just like GE, for instance.
Right. Yeah, we have a separate GE install package to help meet community requirements.
Got it. Another question: if they email the information to another physician, is that secure?
That is a great question.
A lot of questions on transmit, and is it secure?
Yeah.
Okay. So Stephanie just jumped in and said there's a lot of questions about the transmit functionality and whether or not that is secure. That is a great topic. So yes, short answer is it is secure. We use a product kind of built into the backside of our system that facilitates the transmission or the sending of that CCD information, the patient's health information, to another provider. That was part of our actual certification process. So we had to demonstrate that we transmitted that information securely to another direct address. I mean, you heard me a while ago reference the direct protocols. Those are also standards that are passed down by ONC that have to be utilized in the transmit functionality. And so while I said the workflow is similar to an email, it is not actually emailing the functionality. It is securely transmitting it. So you can think of it as sending an encrypted email, if you want to think of it that way. Technically not an email, but it's an encrypted security system that is facilitating that transition. Great question.
There's another one. Does it have to be CCD format, or can you send a document such as like a patient visit summary?
That's another good question. You could potentially send the patient visit summary in a Word document or some type of attachment to a secure message. And likely that will help you with the clinical visit summary measure. Again, I would recommend speaking to your EHR provider about that, but the CCD itself is what is encompassed in the patient online access measure. So a chart summary, things like that. Now that may vary, again, by your EMR provider, but what you've seen today is specifically associated with a CCD.
Okie doke. Here's one. We have an integrated EHR, and we want to know if we send lab or radiology results to the portal, do those also count for patient view, for the patient view?
Great question. Depends on the format in which you're sending them. If you are sending them as attachments to a secure message, that likely would count for, again, just kind of that secure messaging practice-initiated piece. If you're sending them as part of a chart summary, as part of a CCD, and the patient views that information, then that will count for your view, your download, or your transmit.
Okay. Simple question. Where is the CCD view?
That is a great question. So the patient actually accesses the CCD viewer from their inbox. We worked very, very hard to streamline this workflow, all really in an effort to make it easier for the patients to view their CCDs, and again, kind of upping that percentage, that 5%, helping you meet that 5%. So when you send a CCD to a patient, they receive an email notification that you have sent them a secure communication. They can then go into the portal. We give them a link to sign into the portal. They log in, and they will see that they have an unread message in their inbox. When they get to their inbox, they literally have a link that they can click on that says review health information, and that pops up the CCD viewer that you saw today. So it's a very streamlined workflow. And essentially to the patient, they feel as though they've received a new message from you.
Does the prescription renewal from pharmacies count?
I'm assuming they're talking about a secure message, maybe? Or?
Maybe. I'm not quite sure about that one, from pharmacies. Now, that may be touching on e-prescribing functionality. I'm not quite sure.
So all I can say is from a patient perspective, if they do a prescription request, that would count because it's an active stash. That would be a secure message from the patient.
That's correct. If it's patient-initiated, if the person who asked the question, if you were thinking along the lines of a patient-initiated prescription renewal request, that will count for the secure messaging measure. If it is pharmacy-initiated, not quite sure about that one. We may need to dig into that a bit deeper, but patient-initiated will count or can count.
We're reading, sorry.
So yeah, another question, how do we know if Medfusion is a part of the certified reporting solution?
How do you know if Medfusion is part of the certified reporting solution? I assume that the question is more around your EHR certified reporting. So the first place I would go is I would look at the certified product list. So when we send you this deck, the first bullet point, let me get back actually, this ONC certified product list here, if the Medfusion patient portal is part of your complete EHR certification, then we are providing the information that's necessary for your EHR to give you that information. So I would check there first.
Got another one, Steph? All right. Is there a way for the site generator to get reports by location for number of patients registered for the portal? We are trying to see how many patients for each of our offices are registered, but the site generator only shows an overall total for the entire group, and we need it by location.
That's another great question. I believe that work is being done.
It's being done.
Yeah. So I know that there was a webinar conducted maybe earlier this week or last week. Where the product manager who's working on those utilization reports, I believe she told a little bit of the roadmap and what's coming. I know that she is working very hard to break that down into more detail for you, other than just the time frames right now. So again, we've got that quarterly, monthly, weekly, and daily, and I know that she's working on breaking that down by location as well as potentially by provider.
Exactly.
So that's a great question.
We have a few questions simply on what does CCD stand for?
That is another good question. Yeah, I think we often assume that everyone just kind of knows exactly what it's just thrown around. So a CCD is a continuity of care document. All right, so it's literally a care document about the patient. I think CCD was originally formed by there's governing bodies, kind of the ONC works with, and they come up with specific standards. CCD. And it actually originally was a CCR, so a continuity of care record. And then as they began to really formulate the standards, they moved to calling it a CCD. And a lot of times you may also hear a consolidated CDA. That is the newest format, actually, that is required by MU Stage 2. We still refer to it as a CCD, but the actual format and standardized format that's passed down by ONC that we have to follow, and actually your EHRs have to follow, is known as a consolidated CDA. So you may hear that thrown around a bit too.
All right, I think we have time for maybe one more question here. So here's one. If you fax a CCD to another provider, does this count when no email address is available? Okay.
So, okay, the question was if a provider faxes a CCD to another provider,
right.
Does that count? So I believe that's more in the realm of provider-to-provider communication. I'm not quite sure of the restrictions there, the requirements there. However, that type of communication about a CCD between two providers or two healthcare entities is not included within the patient online access pieces. So that would not be included within the view, download, or transmit.
Okay. Let's see if there's one more little thing. Look, this is a good explanation thing. Can you explain the provider online access to 50% of patients? How is this measured?
How is it measured? I think there have been some differing definitions here. So in terms of how it's measured, this may be things such as the actual sending of the CCD to a patient. It may be sending an invitation to a patient. So I would recommend speaking with your EMR provider, your EMR vendor, to see how they are actually calculating that number. That numerator, I guess, is actually calculated outside of the portal itself. So if you're sending an invitation to the patient, if you're sending them a CCD, there are various things that can actually help you meet that 50%. But it does focus on the number of patients seen within a reporting period. All right. So if you are seeing, if you're looking at a quarter, 50% of those patients do have to either be provided a CCD or maybe send an invitation to help you meet that measure. The specifics of it, because that measure is included and the quantification of that measure is included in your certified reporting, I would recommend seeing how your EHR vendor is defining that for you.
Okie doke. So thank you everybody for attending. Quick word of warning, I was a little slow in hitting the record button, so I think Brady's on slide 2 when you, if you watch the recording of this or pass it along to one of your colleagues. But anyway, the vast majority of it is recorded. So it may have a slightly bumpy start. Thank you everybody for attending. Really appreciate it. We will answer all of your questions and distribute a question and answer, and very quickly we'll distribute Brady's presentation with all these wonderful links as well as some other documentation that she put together. Have a great day, everybody.